Hello, welcome everybody to our session. I am going to share our presentation. Hopefully. I'll just do a quick introduction. So we're here to talk about kind of local homeless coordinating committees and how they're structured. And hopefully if you were able to hear some of the video in the previous session, you got a little taste of information about local homeless coordinating committees and how they are across the state. We'll also talk about different models that we have experiences with, and finally, how you can create new programs in your community and be part of a bigger system response. So I'm Tara McFadden, and I work for Salt Lake County in the Mayor's Office of Special Projects and Initiatives, and I work with a team that coordinates the Continuum of Care process and supports the Salt Lake Valley Coalition to End Homelessness experience and committee. Danielle, would you like to introduce yourself?
Yes, thank you, Tara. Hi, everyone. I'm Danielle Stevens. I am the Housing and Homeless System Sustainability Coordinator with the Weber Morgan Local Homeless Coordinating Council. I work for the Weber Prosperity Center of Excellence, which is a department within the County Commission.
Hi, everybody. I am Heather Hogue. I am the collaborative applicant and project coordinator for the Mountainland Continuum of Care, which is Utah County, Summit County, and Wasatch County. And I'm the COC lead as well. So I work with our executive committee to make sure the COC is functioning well and to make sure that we're in compliance with everything that we need to be in compliance with.
Thank you. Our plan for this session is to have time at the end of the session to take questions. So if we don't have a chat function enabled, but if you'll just take notes throughout the session of your questions, and then I think you can raise your hand during that time, and our amazing administrators can let you in and unmute yourself to share with us. So that's the plan. So we'll first talk about some of our governance models. So in Utah, we have 3 Continuum of Care, and they're organized. So the Continuum of Care is a federal funding opportunity, but we've also used it to mean these local planning bodies. And so in the balance of state, it's made up of 11 local homeless coordinating councils. The Mountainland Continuum of Care, which Heather mentioned, is comprised of Summit, Utah, and Wasatch counties. And then Salt Lake County is its own, and it's coordinated through the Salt Lake Valley Coalition to End Homelessness. So a local homeless coordinating county or committee is a group of county or group of counties where homeless service provider coordination should take place. Homeless service coordination, excuse me. LHCCs are instrumental in helping determine priorities and funding for communities. And our focus is really on developing long-term strategic plans that address the needs of homeless individuals and households, the availability and accessibility of existing housing and services, and the opportunities for linkages with mainstream housing and service resources. Where we coordinate at the state level through the Utah Homeless Network. And Jonathan mentioned a little bit about that this morning. We've been meeting regularly, monthly, since the beginning of the year, and increasing those meetings since the beginning of the pandemic. Who should be involved in this process? Anybody that wants to have an impact on homelessness, an impact on your community, should be involved. So domestic violence shelters, emergency shelters, and homeless housing providers, housing authorities, hospitals, behavioral health authorities, universities, CAP agencies, CDBG, CSBG, ESG, kind of the alphabet soup funding administrators, DWS, local political leaders, private sector, current or formerly homeless persons. Basically, if you want to have an impact, there is a place for you to be involved in each of the communities and our statewide response to homelessness. Within the Within our system, we focus on data collection and analysis. There's a few things that we have to do for federal funding, but the information that we collect informs our planning and our processes and how we're doing and where we need to kind of course correct. So those include things like the point in time count, the housing inventory count, system performance measures, and then program level data, which is most likely captured in the HMIS or Homeless Management Information System or a comparable database. We also look at strategic planning, matching available resources to community need. There's never enough money, and so we have to be really strategic about connecting it to places where it's going to have the greatest impact. And facilitating coordination between LHCC communities and state agencies. We also support and establish the coordinated assessment and other requirements to improve community efficiency and maintain eligibility for funding. I will say too that this is not an exhaustive list. So it's this plus anything else that comes up. When COVID hit in the spring, we really increased our collaboration statewide, but I think we were all grateful and fortunate to have this structure already in place. And I think it tightened up the collaboration, and we found new ways and new partners to bring in. And we're doing that kind of evaluation all of the time as we consider the needs in our communities. So next we're going to talk about specifically about the structure in each of the communities we work in. So I'll turn this to Danielle.
The Weber Morgan LHCC has been around for several years. From what we can gather, it was formed in the early to mid 2000s. And in the last year, we have experienced a rather significant restructure. In 2019, our community commissioned a strategic plan and community assessment. And the overall finding of that assessment was that our LHCC was no longer functioning at the level it could, was no longer functioning as well as it had in the past. And the recommendations out of that assessment were really to restructure the LHCC a bit, implement some different accountability structures, and hire someone who could actually help facilitate all these changes in the LHCC and assist the LHCC with aligning to the state strategic plan on homelessness. And so that's where my position comes in. I was hired because of that assessment. And as I mentioned before, I work within the Weber County Commission and under Commissioner Scott Jenkins, who is actually the chair of our LHCC. And the graph you see on the board or on the slide now is actually the way our LHCC looks today. In the last year, we've done a lot of work to engage more executive directors of our providers in the LHCC again, so that our LHCC could be more actionable and so that we could actually work on implementing our local strategic plan and aligning with the state strategic plan. The restructure also included establishing a governing board, and the logic behind that was really to foster better crosstalk between our local homeless service providers at the board level. So that board is comprised of the chairs of all the advisory boards of our major homeless service providers, and strategy for organizations really starts and happens at the board level. And we wanted our provider boards to have a more holistic understanding of how homelessness looks in our community and the needs at all levels in the homeless system. And the Weber Morgan LHCC falls under that governing board. And our LHCC facilitates various subcommittees and activities related to data quality, coordinated entry, funding analyses, et cetera. And I, as the systems coordinator, am the liaison with the State Homeless Programs Office. So through this restructure, we've been able to establish more accountability. We have engaged more executive director participation in our LHCC. And because there is now a coordinator facilitating communication with the State Homeless Programs Office, We've also been able to establish more continuity of information that is being disseminated to the community as well. Next slide, Tara. Thank you. So as I mentioned, we established a governing board. This is one of the major accomplishments in the last year. This governing board, when needed, also prioritizes funding requests that providers are making for state and federal funding. And again, they inform strategic decision-making at the organizational level. We also earlier this summer established a data quality subcommittee across the state. Data quality is a persistent issue, and we are really digging into HIMSS data quality reports and establishing where the gaps are, what the program specific gaps are, and identifying solutions to improve our data quality. And then of course, one of the major subcommittees we have is coordinated entry, which is a HUD requirement for implementing coordinated entry policies and procedures in the community.
I'm going to tell you a little about the Mountainland Continuum of Care structure. So we've got the Mountainland COC body, which is all comers. We try to have representation from all of the lists that Tara mentioned earlier, and then even informed public. I got an email just yesterday from someone that's like, I'm not in an agency, I just want to help. And so the COC body of itself is just comprised of a lot of different entities and people. If you start up at the top, our Coordinated Supportive Services Subcommittee, that's our by name list committee, and we meet every other week with our housing list and our SPDAT list. We talk about who's missing in our agencies, who's got eyes on John Doe. Nobody's seen him for a while. Where is Jane Doe in the housing placement? I know she turned in her application a week ago. And so this is a very specific group of frontline workers that talk very specifically about the people in our community who are experiencing homelessness. Our executive committee is comprised of a handful of people that make sort of executive level decisions. They run the meetings, and they also help determine, hey, our voting membership things need to be signed, and they really help make these sort of policy decisions about the COC. Our Rank and Review Committee is an ad hoc group that we gather just as on a needed basis. We gather every year for the NOFA Rank and Review when when agencies apply for different projects, but we also regathered it for this last round of state funding. And so they look at the project applications from our community, rank them, and decide how they fit into our gaps in our community and how they fit into the services we're providing. Our Public Relations Committee, we work on how to educate the public about homelessness. We have a monthly column in the Daily Herald, and we can use different avenues to sort of inform people about the realities of people experiencing homelessness. And one of the things we're very conscious of in this committee is how do we get rid of those stereotypes and those stigmas that come around homelessness and really educate the public as to what this really looks like. Our Youth and Education Committee is also something that focuses on a very narrow subset of homelessness in our community. We're looking at youth experiencing homelessness, youth who are LGBT a lot, that are going into different shelters or being kicked out of their homes. We're looking at the specific needs for youth in our community, and then education of the general public about how to take care of these youth that have special needs beyond just the needs of people experiencing homelessness. We also have our Discharge Committee. This committee was sort of formed, we've kind of run it for a while, but we had a big reform about 1.5 years ago. We had an individual discharged from a hospital in the middle of January in bicycle shorts and a t-shirt and sandals. And so he's out wandering in the snow at 4 a.m. where he's released from the hospital. So this is a group that works with our hospitals, our mental health system, our jail, and our prison system to make sure that there's a warm handoff for everybody being released. If they experienced homelessness before they were incarcerated or before they were hospitalized, this committee ensures that a caseworker is expecting them. So there's no surprises and there's nobody being handed off into the street with no resources and no socks and no coat in the winter. And then our point in time committee is something that we start in November every year. We get together and it's talk a lot about where can we find people? How can we more adequately count people? How can we do this in a way that gives us the best accurate data? And then our housing solutions work group, this is comprised of landlords, and this is comprised of builders and city officials looking for unique and innovative solutions to housing in our community. We know that we need more affordable housing. And in the speaker's session earlier, she talked about being 41,000 units short of affordable housing, which is just mind-blowing. So this housing solution work group is like, how can we find tax credit projects? How can we incentivize builders to look for affordable housing solutions? So that's the structure of our continuum of care. Would you go on to the next slide for me, Tara? Thank you. And I talked a little about the subcommittees. So this is kind of a repeat. So we can probably go on to the next slide as well. Okay.
So I'll talk a little bit about the Salt Lake Valley Coalition to End Homelessness. So it was created in April of 2019 by building upon the strengths of existing efforts, including Salt Lake County's collective impact on homelessness and the Salt Lake County Continuum of Care. So the collective impact group was policymakers, funders, community leaders, and providers. And the Salt Lake Continuum of Care, which was acting as the local homeless coordinating council, was also mostly providers, but it had really become a process focused around funding and related activities. And then throughout the community, there were other planning groups dealing with issues related to homelessness. And so the idea with the creation of the coalition was to just streamline all of those efforts into one body. And that's the Salt Lake Valley Coalition to End Homelessness. Our goals are really identifying gaps in the system by utilizing data, research, and resources to establish creative and effective strategies to address the gaps, supporting, informing, and collaborating on funding, and educating the public and stakeholders regarding homelessness prevention and solutions. As you may be familiar, we shifted our service delivery system in a big way. Beginning in 2017, the work really started to change from what was essentially a single large emergency shelter to a resource center model. We really prioritized the idea of no wrong door and that it was a person-centered model, so that it's not just an emergency shelter, but at that emergency shelter, a person would have everything that they would need to access to achieve sustainable self-sufficiency. And kind of the spokes along this wheel, you may not be able to see it very well, are community engagement, wellness, legal rights, safety, housing, employment, education, and positive social support. So all around that individual or family. And we kind of took that same concept and applied that to the coalition. So instead of this person-centered idea, it's the community or the system-centered. And we created these 8 core function groups that more or less align with those same spokes. So those include, so the 8 core function groups are led by co-chairs, and each of those co-chairs sit on the steering committee. We like to say or hope that the information flows up and down and in and out, that it's not just a single line of communication. And those steering committee members represent areas of expertise, but not necessarily specific agencies. So the core function groups include crisis response, which deal with resource centers, diversion, client intake, outreach, and food security. Our housing committee, which looks at housing availability and gaps analysis. Health and wellness, which is focused on mental and physical health and substance use disorders. Employment, which includes public and private, training and education. Education, which focuses on early childhood K through 12, technical and vocational and higher ed, and how those opportunities can benefit those that we serve. Our client focus, which is led by Pamela Atkinson and Rob Wesseman, that really hopes to get good client feedback and determine if there's specific interventions or needs by population. Our community engagement group, which seeks to engage with the public, and the government, the community councils, and making sure that our message gets out about what we're doing, and if there are needs that the community has or sees, that there's a place for them to bring those concerns or ideas. And then our safety and legal rights, which partners with CJAC at the county. So it's the Community Justice Advisory, I think it's committee, it could be council, and our public safety teams and how that interacts with our system. We also have a coordinated entry task group, point in time, and our ranking committee that evaluates projects for funding. We also have advisory groups that do targeted work to meet funding or reporting requirements, and ad hoc committees whenever the needs arise. I think as I mentioned before, with collaboration increasing over this last few months, having the structure in place, all of the issues that we needed to address very quickly, there was a place for them to go. And I think that's true of the community. Hopefully they feel that if they have a concern or a need or an idea, that there's a place for them to plug into this system and be heard and be impactful. Our support agencies for the coalition, I'll just mention, are Salt Lake County, Shelter the Homeless, and the State of Utah DWS Homeless Programs Office team. Next, we will talk about new projects and how best to be involved with this process. So I'll send it over to Heather.
Thanks. Okay, so we've had some success in Mountain Land in the last few years with starting new projects. And so I want to talk with you a little about sort of some best practices if you're considering starting a new project. I'm going to talk with you a little about what kind of projects we've started and where we've seen success. And then we're going to talk about maintaining and supporting these new projects. So my basic 1, 2, 3 rules here of starting new projects. Number 1, make sure your new project is filling a gap. Number 2, look for community partners who can help. And 3, think about your long-term funding. Tara, would you move to the next slide? Thanks. Okay, one of the biggest mistakes that agencies make, and this is true of any kind of nonprofit that even you're looking at starting, not just new projects. The biggest mistakes agencies make is forgetting to see if that project fills a current need. So for example, let's make something absurd. You're going to start a new project and you're going to make shoes for the homeless. We're going to make shoes for the homeless. And there's a shoe factory just down the road that diverts 10% of all of their shoes to people that are in need. So you're not going to get funded because they're already doing it well. So your resources, your wages, your staff time going into a project that isn't filling a need, even though it sounds really cool and it's something that you really want to do, is really going to be wasted. It's really surprising when you look at this on sort of a community application. I want to do this project. I think our agency could do this project well, but without checking into the scope of what your community is already doing and what agencies are already doing well, you could potentially have a big problem, and you could potentially create a project that's sort of doomed to fail. If there's an organization that is already doing it well, find another project. Would you go on to the next slide, please? Another big part of starting a new project is collaboration. And under this collaboration piece is finding those service gaps in your community. Consider what agencies that have successful projects are touching on what you want to do. So maybe you're going to do your shoe project, but you want to look and see which agency is doing socks and which agency is doing foot care, which agency is doing running classes. You're going to want to collaborate with people that have already got skin in the game. They are already invested in your community in a similar way as the new project that you're going to do. So I'm going to give you an example of what we did in Mountainland. Last year, when we were looking at state funding, we called all of our agencies to the table who were looking at applying for this funding. We talked about what projects, what renewals, everything that we had going on. And then we had a roundtable discussion and said, what are we missing in our community? So what is your biggest challenge? Center for Women and Children in Crisis, what is your biggest challenge right now? Food and Care Coalition, what is your biggest challenge? Wasatch Behavioral, Community Action, what are you missing right now that you need? One of the things that came out of this discussion is that we were having difficulty finding landlords willing to take vouchers. And we didn't have anybody in our community with the capacity to take on at that agency with existing positions, finding new landlords, expanding our landlord inventory, cold calling, following up with visits when landlords got mad about something. We didn't have this position existing in our community. So Community Action stepped up and said, we would be willing to host this position if I can get support from you on this count, if I can get support from you on this count. We created a landlord outreach position housed at Community Action that partners with the other agencies. In particular, works very closely with the Center for Women and Children in Crisis, which is a domestic service provider, domestic violence service provider. And because of this collaboration and saying, what are we missing? What do we need? We have just had amazing success with the gentleman that they've put in this position is like dynamic. I mean, he gets it done. And working with these agencies that have a connection here, I've got landlords that'll house for domestic violence, give them a call. Let's work with them. Let's massage this relationship. We have found that it did more than what we were even hoping to do when we came to that roundtable discussion. So as you're collaborating, as you're looking, no man is an island, no agency is an island. The more you can work together, the more you can brainstorm together, the more you can openly discuss what these service gaps are, the better luck you're going to have when you start looking at finding a new project and funding a new project. Tara, would you go on to the next slide? Thank you. Something to consider when you're looking at funding homeless projects specifically. If you're going to start a new project in homelessness, there are only a handful of project types that can be funded by state and federal funding. It is much, much, much easier to tailor your project to funding sources than to try and tailor federal or state funding sources to your project. Believe me, that is not an easy thing to do. Federal funding has like crazy mad hoops that you've got to jump through sometimes. And there is a very, very comprehensive list of the types of homelessness projects the state and federal government will fund for us. And we're going to cover that in just a bit. As you're considering these project types, don't get too crazy. Follow the letter of what these project types are intended to be, because something that I have learned through my own experience and sometimes my own failings is that you get super excited about this new project and you're like, this is going to fit. I'm going to make this fit. I'm going to jam this like square peg into this round hole. It doesn't work that way. And enthusiasm alone cannot make a project fit into required funding sources. Would you go to the next slide? I think that's my... Okay, and I think, Danielle, you're going to talk about project types. So I'm going to hand off to Danielle.
You bet. Thanks, Heather. So as Heather mentioned, there are a small handful of projects that can be funded by state and federal sources. So when you are looking to develop a project in your community that you want to be federally or state funded, you will want to try and fit that project within one of these buckets. These funding sources are designed to serve people wherever they are in the homeless system. So street outreach projects are really designed for the most vulnerable, unsheltered people in your communities. This is for people to reach people who are inhabiting places not fit for human habitation and to connect them with critical services and ideally housing. Emergency shelter is for those who are, or it's for operating emergency shelters to keep people, within shelter as they are working to move them into housing and out of the homeless system. Rapid rehousing is designed to move people out of homelessness as quickly as possible. Rapid rehousing includes rental assistance, typically short and medium term rental assistance, and short and medium term case management services. Homelessness prevention is really designed to keep people from ever entering the homeless system. Keeping people from entering the homeless system means that they have a less likelihood of remaining in the homeless system and returning to homelessness in the long term. HIMSS comparable databases are for agencies that, for whatever reason, cannot enter into the homeless management information system. Typically, these are for domestic violence service providers that have specific regulations on the type of information they can provide to the community about people they are serving. Next slide. Thank you. Transitional housing is another housing model to move people out of homelessness and into housing, typically prioritized for people who are experiencing domestic violence, youth projects, and homeless respite care for individuals staying more than 90 days. Permanent supportive housing is specifically for people with disabilities. Individuals in these housing programs can remain on them for as long as they want to. It is designed with long-term supportive services that the individuals can access. Those services are not required, but they are always available for individuals in PSH projects. Single room occupancy projects are, they provide rental assistance and typically rehabilitation of housing in communities. These types of models are for individuals, not for families experiencing homelessness. And this type of housing, I like to compare to like a dorm type of situation. You typically have a set of rooms that, you know, they share bathrooms and whatever. And so it's that type of living situation. Diversion activities are really to help people when they present at a shelter or another program or in the system, that they are, if needed, diverted to other services that will help them end their homelessness. And then any projects that do not fit within these buckets are classified as other. When you are funded for any of the aforementioned projects, there are things that you are required to do. First and foremost, to participate in your LHCC activities, specifically coordinated entry processes, as well as aligning with the statewide strategic plan on homelessness, entering your information into the HIMSS system or a HIMSS comparable database, participating in PIT counts and the housing inventory counts, and reporting your data to the state.
Thank you. So that is all we had in terms of our presentation, but we would like to open it up for questions. And Sarah or Holly, would you go over how people can ask questions?
Sure. If you will have a raise hand feature. And so anyone for the attendees, if you just want to raise your hand, either one of the staff, either Sarah or Russell or myself, can allow you to talk if you've got a question. Right now, I'm not seeing any. So I'll just keep my eye out for that and let you know. Okay, looks like we have got Peggy Green. And Peggy, I've allowed you to speak. If you want to just unmute yourself, you can go ahead with your question. Maybe she's dropped off. Peggy, are you there? Okay, looks like she's dropped off. Looks like we now have someone from slco.org, maybe Adam Ford, something. So I'm going to unmute him or her, and then you can make sure to unmute before you ask your question.
I did not have one.
Oh, okay. Looked
Sorry.
like your hand was raised. That's okay.
And this is Sarah. Can I ask a question?
Absolutely.
Of course.
How can you explain how each of you may address capacity building for agencies providing services in your area? What type of support structure you've offered to help those agencies grow in clients?
You cut out a little bit, but I think I can answer a little bit about what we do. As we have funding opportunities come up, we try to do outreach to agencies that may be interested in applying, and and also a lot of training about what the requirements are, and hope that we can provide some support in kind of molding that project or making sure that the project is going to fit within our needs and our process. And we're definitely like, if at first you don't succeed, try again. As Heather mentioned, as Danielle mentioned, a lot of these programs have really narrow definitions, and the best intentioned and the best developed program still might need some tweaks to make sure that it can fit into a place that we can fund it. And I think that's in part so that we can standardize how we're talking about things, and so that everybody's doing the same thing across the state, across the country, across our community, to make sure that you know, if you enter into a rapid rehousing program, you're going to receive same or similar supports anywhere. It's not, it shouldn't be the luck of the draw that if you fall into a good program or a not so great program. Yeah, anyway, so I think encouraging lots of participation and early participation in all of our different core function groups, so you can start asking questions and start seeing where the needs may be. Now, Danielle or Heather, do you have anything to add?
Yeah, so in the Weber Morgan area, the creation of my position specifically has really increased the capacity for providers in our LHCC, because they no longer need to take charge of requirements that come from the State Homeless Programs Office, like gap analyses and funding prioritizations. And that has taken a rather large load off of their responsibilities as providers, and allows them to focus on continuing to operate their organizations and increase their individual organizational capacity, because they don't need to be concerned about those kinds of things, but participate in the process but not need to lead it out. Additionally, creating our data quality subcommittee, while it's in the early stages of building capacity, ultimately improving our data quality will mean that as a state and as a community, we're able to obtain more funding in the future. So that is absolutely a long-term plan. In terms of COVID-19 response, which obviously no one planned for, no one expected, because we are so connected, the LHC is so connected with the county commission, we have been able to establish really robust partnerships with the health department and human services to provide COVID-19 response for individuals experiencing homelessness. And the health department manages and pays for a quarantine facility so that homeless service providers are not needing to be concerned about isolating people who are positive for COVID within their individual shelters, but those people have a place to go. And that releases pressure on those providers and on that staff so that they can continue serving people who are healthy and avoid reduced staff or spreading the virus in their agencies because they've needed to isolate people. I think that's all I have.
I think, my thoughts on capacity building is that number one, it takes communication. It takes communication between the providers that are already there and the providers that are looking at starting new projects. And sometimes it's a provider that says, hey guys, we're missing something in my community. And with that line of communication, you kind of have to put your ego aside a little bit as an agency and as a provider and listen when you've got service gaps are identified. And you also have to refrain from getting territorial. And I know that can be a real challenge as we're all competing for the same sort of dollars. But what we have found in our community is when we collaborate, we get more money than if we compete. And that's been sort of a recurring theme for us the last couple of years as far as capacity building. Additionally, as we started collaborating a little bit more and a little bit more thoughtfully, we found that projects that we previously thought were out of reach or out of the scope of our continuum became almost low-hanging fruit. One example of this is that Provo City Housing operates in our area, and they came to the table and they said, hey guys, we got this idea. It's crazy and we're gonna need a lot of help, but we've got this idea. And what they did is they took 2 old motels and converted them into permanent supportive housing, which, frankly, we all need. It was crazy expensive. The master leases were crazy complicated. Permanent supportive housing requires support, So they came to the table and said, hey, we can do this, this, and this. Who can do this? Who can do this? And who can do this? As a result, and I will say a direct result of their efforts and the collaboration going on project building in our community, we've halved our chronic homeless list in last year because we got a place to put them. And this is not a project that 3, 4, 5 years ago we had capacity for, and Provo City Housing does not have capacity on their own. In fact, it's a big stretch project for them. But because of the buy-in from other agencies and because of their willingness to say, we can't take all of this on by ourselves, we've really found this to be not just a successful project, but a successful project model as well. So when we look at doing future projects in the same vein, we know what to do and what not to do and who to come to the table. So that's kind of my thoughts on capacity building is the communicate, don't be territorial, put your ego aside and ask for help. So there's my thoughts. Great question.
Answers, thank you. Maybe I could ask a follow-up one if nobody else has any other questions. I'm not seeing any raised hands. Is there capacity in the future to expand what other funding sources are supporting agencies in your areas?
I can start with that if you'll want. Yes, with an if, no with a but. No. Yes, we have lots of things on our wish list that are going to rely on capacity building, that are going to expand into other geographic areas that we feel are currently underrepresented when it comes to state and federal funding. But it is going to require capacity building. It's going to require effort. It's going to require thinking outside the box. And we're absolutely going to do everything on our wish list. I'm quite convinced, but it may not be before I retire in 40 years. So.
I'll say one of the, I guess, I hate to say benefits, but silver linings of this horrible pandemic is that we really tightened our collaboration with our federal partners, but also our state and local funding partners. So the city and the county and the state all get separate pots of money that may feed into our community. And our funders were really great about coming together and saying, okay, if I fund this piece, then if you will prioritize this other piece and this pot can prioritize this other piece, then we can all fit together. And I think having that, that vision and that process in place will strengthen our ability to go to private funders and say, look, we're already collaborating on all of these things. Here are the needs that we have in our community. It would be great to have some private, super flexible funding to fund this piece that we know is crucial to ending people's homelessness that none of these other pots can touch. And I think that that will, without some of the burdens and reporting requirements that come with state and federal dollars, that we can fund some really innovative programs that maybe don't have the capacity for huge reporting burdens, but are doing innovative, amazing outreach or programming for those that we serve that are absolutely vital, as vital as the housing piece in ending people's homelessness.
And in our community, we, in the last year, have had at least one very viable opportunity to use some local funding sources for a project. But you know, sometimes, even if the funding is available, you run into other obstacles like policy issues and city ordinances, et cetera, that can make, even if the funding's there, it can make implementing that project very challenging. One capacity building piece that isn't, it's tied to homelessness, but not specifically in homelessness, that we are trying to run with is an affordable housing panel, which consists of mayors and other leaders in the Weber County area to really come together and talk about affordable housing issues. It's definitely an upstream capacity building strategy. We're really looking at how we can pursue more affordable housing in our community so that we can get upstream with homelessness and try to prevent people from entering it in the first place because they can't afford housing in the area.
It looks like we have just a few, like 5 more minutes. Is that right? Any parting thoughts that if there aren't any questions, or if you think we've covered it?
Do you have any burning questions that you came to this panel with that we didn't cover?
Well, we can leave that up to you guys. If you have anything else more that you want to say before we end, and seeing that there's no other questions at this point, we can just take a short break before the next session starts. Unless you want to have any last thoughts, anything, it's your show here.
I don't think I have anything other than just to share our contact information. Please reach out to anyone, any or all of us, and we can do our best to answer your questions and or point you to the contacts in your local area that may be able to help, that are doing the same work that we are doing. When you mentioned Peggy might have a question, I was like, oh, she probably doesn't have a question for us because she could be teaching this too. So there's a lot of us's all over the state doing the same work that we do, and we're grateful for our collaboration through the Utah Homeless Network, and we're happy to have shared here at the summit. So thank you all. And if any other thoughts, or are we good to kind of end there? It's awkward not seeing an audience. I will say that.
I know it's different, but yeah, you guys were great. Thank you for your presentation. Thank you for being a part of this year. Hopefully next year it'll be a little different. More personable, I guess.
Yes.
Yes. All right. Well, thank you guys so much.
Thanks all.
Thank you.
Thank you.
Okay. Should we stop recording
Session.
then?
Yep. I'm going to go ahead and end this.
Okay, thank you.
Yep. So